How would you describe pelvic floor physical therapy and what it is?
The thing with pelvic floor is it's just not limited to women
Mm-hmm.
and not just limited to maybe the geriatric population or postpartum um, cases or menopausal women.
Mm-hmm.
You can see some issues as well among men and athletes, runners,
Mm-hmm.
Yeah.
So,
And you know what? With that being said, these muscles we utilize every single day.
correct.
Like
Mm-hmm.
we pee, we poop,
Mm-hmm.
and hopefully we have sex on some point.
Mm-hmm.
And you are using all these muscles that I just showed you,
Mm-hmm.
and a lot of dysfunctions can occur in, with those muscles involved. So
Mm-hmm. So right. So aside from incontinence and yeah, bowel incontinence, urinary incontinence, and sexual dysfunction, are there any other conditions that a patient would want to go
yeah.
into pelvic health physical therapist?
Yeah. So I see a lot of patients with urinary incontinence,
Mm-hmm.
whether it's a stress incontinence or urge incontinence. There's also bowel dysfunctions. People might have some sexual dysfunctions or pain.
Mm-hmm.
I can tell you a really good story. This is kind of like one of my favorite because I had a patient who she was a cervical cancer survivor,
Mm-hmm.
and she went through chemotherapy and radiation. And then after the after the cancer treatments, um, she knew that there was a little bit of damage, and she was experiencing a lot of pain. And by the time I saw her, she said, "Of course, you have to take all the history and everything." The one thing that she told me is that I really just want to um, feel normal again and not have pain
Mm-hmm.
because I am on the verge of having divorce. Well,
Oh.
because she said, I've been married all these years, and my husband and I have been together for many years since high school, and I have not been able to tolerate um, if we make love just because
Mm-hmm.
it's so painful.
Mm-hmm.
So, you know what? One treatment of physical therapy, she called me the next day and she was just like flabbergasted. She just like, I cannot believe I should have known this.
Oh
I should
wow.
have seen you before. I should have had the talk with my doctor about this, or maybe my doctor should have referred me to you because you just saved my marriage.